In this chapter, we're going to talk about anxiolytic medications and other interventions to treat anxiety disorders. There are a variety of disorders that fall under the category of anxiety disorders. And as you can see, it ranges from generalized anxiety, social phobia, panic disorder, all the way to obsessive compulsive disorder. Post-traumatic stress disorder, although it's no longer in the DSM-5 under anxiety disorder, for the sake of, from a pharmacological stance, many of the medications that are used to treat post-traumatic stress disorder are also used to treat anxiety disorders, which is why it is in this chapter. Now, looking at the medications, there are a variety of type of medications that can be used to treat anxiety disorders. But first, of course, just like with other disorders, we are looking at what the symptoms are in order to figure out which medications would probably best at least reduce or alleviate those symptoms. And for the sake of this chapter, of course, we're talking about the anxiety symptoms. So we're looking at barbiturates, which is an older medication that was used because it has a sedative, this hypnotic effect. But the problem with it is that it's a wide spectrum of effects. I mean, depending on, of course, the dosage that's prescribed and what's taken in, but it can range from a mild sedation all the way to a total anesthesia. So because of this effect, of course, we're taking a chance of a client maybe overdosing, especially if those anxious feelings and the symptoms are very intense. It could be, let me take 2 pills this time, or let me take 3 because they're not working, and because of it could be lethal. What has happened is in recent times, benzodiazepines have kind of replaced the barbiturates because the benzodiazepine will also promote relaxation and reduce that muscle tension and all those physical symptoms that come along with anxiety, so that perhaps other types of therapy can come in, which could be bringing in another medication, as well as looking at interventions that are used in therapy. Something that's very important is that even with benzodiazepines, although they are used in treating many forms of anxiety, it's usually for short-term management because it can have an addictive quality. And we look at the benzodiazepines that have gone under the brand name of Xanax or a Klonopin, a Valium, Ativan, and there are a lot more. But with these, depending on if it's on an as-needed basis, and that's why they're prescribed for a short period of time. Now there can be also withdrawal symptoms because of long-term usage if it's used more than 2 weeks, because a tolerance and of course a dependency can occur. So although they're not as lethal per se as a barbiturate, and they have kind of replaced barbiturates, it's still only kind of expected, or we only want them on there for a short period of time so that the addiction component does not kick in. With buspirone, what we're looking at is, although it's used to treat anxiety, as mentioned with a benzodiazepine, the difference is that buspirone has more of qualities that are similar to the properties of an antidepressant. So this may take 3 to 4 weeks before this medication may take effect, whereas a benzodiazepine will take an immediate effect, once they take the drug in. It's almost like drinking alcohol, that glass of wine, or taking a few shots. You're going to start feeling it within, whether it's an hour, 45 minutes, just depending, unlike buspirone, where it will take time, like an antidepressant, to get in the system and to finally kick in. Now, many people will go to their general practitioner before going to a psychiatrist. So when they're saying they're feeling anxious, a benzodiazepine might be just, quickly prescribed. But when we're looking for long-term medication management, and seeing a psychiatrist. What we're looking at is, although it may take away the immediate effects or take that edge off, we still need some kind of medication management, as well as there might need to be some psychological interventions, some coping skills that client needs to gain to deal with those anxious feelings or when they are feeling the symptoms. So buspirone is usually used in the treatment with clients with generalized anxiety. But also, buspirone may also alleviate depression from clients who are anxious and may have a co-occurring mood disorder or have concerns of a co-occurring mood disorder. Beta blockers can be used for more social anxiety, and it's used pretty much so to bring down the physiological symptoms that a person is experiencing. And out of the various anxiety disorders, social anxiety, the client might, start sweating or rapid heartbeat, palms, might get clammy. So the beta blockers are more so used with this anxiety disorder to alleviate the physiological symptoms that are occurring because of their anxious feelings. I forgot to mention, because I've been covering benzodiazepines as almost like a blanket that's sometimes prescribed, but benzodiazepines are really great for clients with panic disorders because, of course, it will relax them. So out of all the anxiety disorders, even though benzodiazepines can be used as a blanket, it's really effective with panic disorder. But then as you read in your book, you'll find that there are 3 stages to treating panic disorder, and the benzodiazepines is stage 1, so that the next step, and stage 2, where antidepressant therapy, medication therapy, or something like that will be implemented. But now moving forward, we talked about buspirone, which is great for generalized anxiety, and beta blockers is great to treat the physiological symptoms that go on with social phobia. Now, before I go on to talk about other medications that can be used for the treatment of anxiety disorders, I just want to make a note that when responding to anxiety disorders, psychotherapy is also very effective because the medication is just going to assist with, like I said, if it's a benzodiazepine, with getting that initial edge off, or if we're looking at a buspirone or an antidepressant, which I'll talk about in the next slide, that's more of a longer treatment medication plan that can help with the anxious feelings. But from a counselor's stance, relaxation techniques, those are like those coping strategies or coping skills that they can learn in a session with you or various sessions, so that once that edge is off or when they feel it coming, they can implement some of these techniques. Cognitive therapy is also great in changing those illogical thoughts to more logical, rational thoughts, because sometimes, just depending on the disorder, they can talk themselves into, those anxious feelings, and then, of course, that's what's going to lead to the physical symptoms. And then cognitive behavior therapy is also great because, of course, we are having them, change those illogical thoughts, but also implement the various behavioral strategies, which is helpful because medication can only do a certain amount, but especially with this disorder, they are definitely going to need the combination of therapy along with medication to reduce relapse as well as to maintain those symptoms and to manage them. Other medications that can be used are antidepressants. We have selective serotonin reuptake inhibitors, as well as, which are the SSRIs, as well as serotonin norepinephrine reuptake inhibitors. And what they have found is that, and it's like one of those things where how can we explain it, but we really can't when it comes to the neurochemicals in the brain. But for generalized anxiety, post-traumatic stress, obsessive compulsive disorder, as well as panic disorder, they have found that antidepressants have worked. If we're looking at the selective serotonin reuptake inhibitors, the SSRIs, or even the SNRIs, in some way, if the anxiety is due to the amounts of the irregular amounts of serotonin within that person's brain, then what we're looking at is that's why they might be showing symptomology of anxiety, of these anxious feelings because of that. So it's one of those kind of trial and error things of if with the initial edge off, taking that edge off with the benzodiazepines. However, they are still experiencing it to the severity and the intensity. We might look at for long-term treatment using an antidepressant as opposed to just the short period of using the benzodiazepine. So it's best to look at it as we're looking at long-term treatment from a medication management stance, that certain things such as buspirone or antidepressants are great for treating as well as relieving the symptoms that are associated with anxiety. Tricyclics, which is another antidepressant that inhibits the reabsorption of the neurotransmitters serotonin and norepinephrine. Once we're looking at long-term treatment, a tricyclic is a great one also. But we're finding is that SSRIs, and especially the newer ones, are being used more to treat depression, anxiety, as well as other disorders.